Welcome aboard, folks. I'm Stephen Malkowich, your captain on this adventure called Ship of Fools. I'm a fool. Lucky for you, I'm not sailing solo. Join me and a boatload of people, all just trying to make sense of this crazy world. It's a fabulous mess, and you're invited. Welcome to Ship of Fools, where wit meets wisdom. We have a special guest with us today, Dr. Raghav Saini, who is an orthopedic surgeon in British Columbia, in the Lower Mainland of BC. Welcome, Doctor.
Good afternoon. Thank you very much for inviting me to your podcast. It's a pleasure.
And the big reason that the wonderful thing about having this podcast, Doctor, is that it gets to invigorate me, and I get to embrace my curiosity. And you and I met through circumstances which we don't have to discuss.
Yeah.
But we had a very interesting discussion, and I went, you know what? This gentleman, this doctor, has a story to tell, and I would love to have him on the podcast. And you so graciously accepted. So Thank you for coming. I appreciate it.
Thank you for offering, I would say.
So what we've titled this is that I call it a surgeon's Odyssey, but healthcare has become quite an issue. It always has been quite an issue here in the province of British Columbia, not just British Columbia, Canada as a whole. Yeah. And what I wanted to start off with is just kind of like a little bit of a biography of your background and where you came from. And obviously we start your roots in India, and then how you made your way here, and then we can get into further discussion.
So I come from a village from northern part of India, which is Punjab, and it's a village in district Hoshiarpur. And I come from a farming family. I'm only child of the family, and I think I was in about 6th or 7th grade when I told my parents that I want to be a doctor. I was too young. I don't know what was the reason behind it, although my family had a good reputation in the region. But occasionally there used to be one doctor who used to visit from the nearby town to my village. And then I used to see a lot of respect for that one physician, and that extraordinary respect for him. I think that might have influenced me. That is one. Eventually, my cousin, Dr. Karan, he became a doctor. And I think these were the few things which, encouraged me to become a doctor eventually. So that I was always a bright, academically good student, hardworking, I would say. I would never say I was intelligent. So that was the start of the journey to become a physician. Basically, I was very young. Yeah.
So where did you go? You went to the government medical college in where was in
Amritsar, Punjab. Yeah.
Okay.
So you might have heard of Golden Temple.
Yes.
So Amritsar, Golden Temple is in Amritsar. Yeah.
Okay.
And I did my medical school from Amritsar. You have to give an entrance exam. So many entrance into a medical school in India is not similar to what we have it here. It's more of a meaning based upon this interview basis here in Canada. So which is kind of a little bit subjective.
So explain that. The process getting into medical school in India. Is it based on theory knowledge, or is it like, because here I to be honest with you, all I know about getting into medical school here in Canada is it's really hard.
It is hard. It's hard everywhere though. But then I think the criteria for getting into medical school here are more subjective too, because it is based upon the interview. So we really do not understand what they're gonna take into consideration for you to for your kid to take into the medical school. But in India, I think the advantage was that based upon your knowledge, there was an exam, and in that exam, all the students from all over India will appear. They will take that exam, and then you will be ranked. You get a ranking, and you will be, if you get a rank within certain range, let's say if there are 1,000 seats and you got a rank 500 or whatever, I got 53rd at that time. And then you will get a medical school of your choice. wherever the seat is available. I think that is more objective.
So what is the process in Canada here? Like when you I know that you obviously you start in the sciences, right? You get an undergrad in science.
So in India we started immediately after 12th, and here after 12th you do the graduation in the sciences, health sciences, do a four-year degree, and then you apply into the medical school, and still then you have to show your personality traits, leadership, community involvement,
So it's more
even the
subjective.
research criteria, and every student work really hard apart from being academically very well. They also have to do a lot of extracurricular work to fulfill the criteria, and even when all the applications, they have great applicants, you still choose very few of them. I personally believe there is not a great objective criteria for the medical students here, so I feel a little bit empathetic towards them.
I understand.
I understand. But then when I was doing a medical school, it is just mostly a theoretical knowledge. You do not make decisions independently. I think the foundation of you being a physician or a surgeon is laid when you do a residency program.
Okay. So that the medical college or medical school, so you take as a criteria, you're writing a test basically to be ranked. Then you go on, and it's based on theory, your knowledge, and then how long is that program? Before you get into an actual residency?
So that is a 5.5-year program in India.
It's 5.5 years,
but directly after 12th grade.
Right after 12th grade.
Yes, yeah. And then you take another entrance exam for getting into the residency program, which is, I think, very difficult to get into it in India. But again, no subjective criteria. Again, entrance exam, and based upon your ranking, whatever the seat or whatever the branch of your choice is available, you're going to get that.
Okay.
So I applied in various exams. AIMS and PGI are the two most prestigious hospitals and tertiary care hospitals where the residency programs are being offered, apart from many other residency programs all over Canada. But these are the two which are the most prestigious ones. And I got 6th rank in PGI entrance exam from all the students applied from India, and got into orthopedic surgery residency at that time.
What drew you to orthopedics?
So, very.
You need to take a drink of water. Feel free. It's okay.
So, I would say very interesting. It's very different from Canada here.
Okay.
In India, again, because you are being ranked based upon the entrance exam, and there is a collective pool of the residency positions, and the first the person who is ranked first will be offered everything, right? And he will make a choice whatever they want. So in India, because it's a developing country, we don't have much of information, and they don't lay much of a emphasis on what you really want. So you get advice from the seniors, from your doctors, and if you have somebody in the family, to take this branch because this is now gonna do better eventually for you. And you, based upon all the advices from your friends, seniors, you make those choices. Apart from that, and in comparison, Canada, the way we make choices are that we do rotations in various branches, and whatever appeals to me, we get into that. And then we try for those residency positions only. So I decided, meaning I chose orthopedics without much of thinking that this is what I want to do. But I fell in love with orthopedic surgery along the way while I was doing it. Basically, I think orthopedic surgery as a branch gives you the opportunity to give your patients a lot of happiness. And I basically work for patients to be happy and come back and say thank you to me. And many of the elderly patients for whom we do hip and knee replacement surgeries, we get rid of their pain. They are functional. They have a better quality of life. The next day, the same day or the next day when we're gonna make them walk, they give you a hug. They will bless you. They will be like so happy because all the arthritic pain has gone away. So that gratitude towards us, what we do for them to improve their function and the quality of life, is immense. And that makes my love for orthopedic surgery even,
Well, I have a personal story about orthopedic surgery.
Yeah.
I grew up. My father, who's passed away, he ever since I was knee high to a grasshopper, he walked with a limp, and until he got his knee replaced,
yeah,
he didn't walk with a limp,
yeah,
and he didn't have that pain in his back,
yeah,
and that ended up. He ended up getting that surgery out here. He lived in Manitoba, but he came out here to get that surgery because the medical system. That's right. It was
Yeah.
just
Yeah.
like, and he was and he needed it, and it affected his quality of life.
It's the quality of life,
Yeah,
right?
and it changed it.
That's what I'm saying. Meaning you might not know, during the last century, the best surgical procedure, which is considered in all the surgeries invented in the last century, is total hip replacement surgery. It totally eradicates the pain of the patient without much of the like effort put in by the patient, because for a knee replacement surgery, a patient has to do a lot of physiotherapy. But for hip replacement surgery, the next day you will feel a lot of difference in your pain, and you will obviously will state that, oh, you know what, now the pain is only from my operative scar. My pain which was existing previously is no more there, right? So people understand that, and they appreciated that a lot. Yeah.
Okay, let's get on your journey to Canada. How did you? So how long did you were practicing? You obviously you graduated in from medical school in India.
Yeah.
And how did you end up in Canada?
Yeah. So I think there are few things about India which do not, meaning Indian healthcare practice, I would say, which do not align with my personality. Uh, Meaning most of the doctors are good, ethically nice, but then when you work in a private healthcare system in India, you may be pushed towards the business side of it or the financial side of it, and then which certainly I was not very happy with when I was starting my career. So I was looking outside at that time, and then I applied for fellowships in Canada. I got fellowships. I got my permanent residency approved very immediately. So I had 2 kids at that point of time. Now I had the opportunity to live in Canada, understanding with the fresh air, fresh water, quality of life, which is way better. And as meaning, I certainly respect India in many ways, but then we also have to acknowledge what are the problems associated with our system. So, meaning the water levels are going down, the air pollution. I think I don't know
in
if you
India?
have
Oh,
heard.
we've
Yeah,
been to
yeah,
India.
yes,
The Delhi,
yeah.
the whole like it.
So and the system, nobody talks about it. Nobody's trying to do anything to improve the quality of the normal day-to-day life for their citizens, right? Even if they are doing, but then it is not effective, right? And I'm not trying to criticize anybody here, but then these are the circumstances.
It's a reality.
And it is my life, and I have the right to make a decision about myself. So that's what I was thinking, and now I have the right and the opportunity to live here, to keep my kids here, grow them here. So I thought that, you know what, meaning I should try to re-credential myself to get into the orthopedic surgery again, because based upon the fellowships, I was not able to.
Explain that process. So you come to Canada, you apply to come to Canada. You're an orthopedic surgeon in India. That process that you have to go through.
Yeah.
Because nobody, it's like, where does the electricity come from? Kind of thing. Like we don't, and that's one of the reasons I wanted to talk to you, is I want to understand this.
Yeah. I think there's a lot of, it's going to test your resilience and grit a lot. I would say re-credentialing yourself, being an orthopedic surgeon, doesn't test your knowledge. Again, it tests your, I would say, personality, your identity, your hard work, grit, resilience, everything. So I came here and decided to get into the residency program, without which I was not able to get the license, and then I cannot work as an orthopedic surgeon. Getting into the residency first will require qualifying the exams first, for which you have to take some MCC, Medical Council of Canada exams. At my time, there were MCC EE, QE1, QE2, and NACOSCI. There were 4 exams to qualify just to apply for the residency program. I don't think right now that we have that many. I think we have QE1 and then OSCE exam, as far as my knowledge goes, but I might be wrong based upon the current situation. But there are some qualifying exams. First of all, you have to clear 1. Second, you have to be a permanent resident of Canada. Only then you can apply for the residency program, without which you cannot.
So that process, what year did you come to Canada?
2015.
2015.
2015.
2015. So we're talking 11 years ago.
Yeah.
Okay, so when you first came to Canada, where did you come here, or where were you?
I was in Calgary.
You were in Calgary.
I was in Calgary. I did my hip and knee arthroplasty fellowship there. I was trained in primary and revision hip and knee arthroplasty surgeries. Then I did my orthopedic musculoskeletal oncology fellowship for bone tumors, and then hand and wrist fellowship while I was waiting to get into the residency program. So during those 3 years, I was taking all the exams, doing observerships in Ontario, because all the residency programs which offer residency positions in orthopedic surgery are only in Ontario. And there are only 4 positions all over Canada for orthopedic surgery residency per year for immigrants. For IMGs, not for immigrants, I'm sorry.
Okay.
Yeah. And which means IMGs also include your or my kids who have gone to UK or Australia and coming back after their medical school. They will also be considered.
So there's really not a lot of...
Not a lot. In orthopedic surgery, though, there are a little bit higher number of positions in family medicine. So it's very competitive, and it's an uphill task, and it's gonna test everything you have but your knowledge.
Yeah. So okay. So you go to Calgary, then once that's done, do you have to take more exams?
Yeah, meaning I said during that period, I took more exams, qualify myself to apply for CAMS, which is a application for residency in Canada. And then you apply for that. Then there will be an interview, which again, obviously based upon your subjective criteria. And I had a very great academic record from PGH Chandigarh, which is again the premier institute from India. From here, I did my orthopedic surgery residency, and I had about 25 or 26 research publications in a good journals, on the index journals. Apart from that, obviously surgical skills. I went there in Ontario, worked in all the 4 programs as an observer. They were very nice. They gave me opportunity to work with them also, and had a time to evaluate myself, and that kind of helped me.
So that whole process to me sounds like you have to be really, really freaking resilient. because there's a lot of times that you
Yes.
go like,
Yeah.
so like, is it the same getting into the US? Or is it, or maybe do you like, what, how, because this is one of my pet peeves here is we not only have a medical doctor shortage, we have we have orthopedic, we have a surgical shortage. We don't have enough.
Yeah.
And nobody seems to be addressing this, and no one's suggesting that we fast track it and we put in competent just to get to the point that you're at. And I don't care what country you're in, it really doesn't matter. To get into medical school, you're not some schlub off the street.
Yeah.
You've got to know. You have to know
Yeah.
something. Like I like I always use this doctor as one of the, when you go into grade school, and there's somebody really brilliant in the sciences when you're in grade school, and then they become a doctor, you're not shocked.
Oh no.
You go, oh,
Yeah.
oh, I could see,
Yeah.
Jimmy becoming it because they really had the aptitude for that.
Of course.
So it's not like they're letting dummies in there. That's not to say there's not incompetent doctors.
Yeah.
But the process that you've just walked us through here really shows there's some resilience here that you've got to.
There will be dark days. You have to keep showing up.
Mhm.
Yeah, you need to still be resilient and have belief in yourself, even though results are not showing. I remember till the time when I got into the residency program, during my 3 years of fellowships, I felt like I was walking in dark, and there was total darkness. And meaning the way I felt about it, if I just portray it, and I did not know what my next step will lead into. So being a doctor, meaning in medicine, we are trained to be leaders and we lead teams. And when I was in India, we do that, and then come here, and then you go through that much of a darkness. It entails a lot. It tests your mind
Mhm.
in all the ways possible, and your grit, so that meaning and then it is your belief in yourself and the faith in what you want to do in your life, I think will help you keep going. I think that is the only solution in that,
So
and
you
at that time.
so in Calgary, you're in Calgary for 3 years?
3 years.
3 years. And then did you come directly to Vancouver from Calgary?
No. So I went to
Ontario.
Ontario. So because
Okay.
the residency program is in Ontario. only.
Okay. Sorry.
So Thunder Bay.
Okay.
Excellent residency program, Northern Ontario School of Medicine. Great preceptors, great people. I had huge amount of respect for all the preceptors, including Dr. Marion, Dr. Wilson, Lefrancois, Droll, Cullinan, Pandey, and my most favorite human being on earth, Dr. Pascas. He influenced me a lot, meaning my approach towards life and towards orthopedic surgery is very similar to him. He is my preceptor, nothing to take away from him though. But I felt after working 3 years here in Canada, he was the first person who made me feel liberated, who made me feel that yes, I was trained well. And then I worked with him during my first rotation only for 1 month, and great human being, very, very efficient, proficient in his work. He works with the level of force which is required for that particular task. These are the few things which I learned from him. So when we review each other, he reviewed me and I reviewed him. So that's the one word which I remember for him, that I've told him that you made me feel liberated. And the other thing which I learned from him was relentless. And that is what I am also.
Relentless.
Yeah, I think that's the motto of my life. Just be relentless. Strive for precision, excellence, and efficiency, and give the best patient care to your patients, which they basically need from you.
Mhm.
Yeah.
So you're in Thunder Bay. How long were you in Thunder Bay for?
5 years.
5 years.
5 years. So my residency program was associated with the University of Toronto.
Okay.
And so I was moving back and forth between Thunder Bay and
Toronto.
Yes.
Okay.
Yeah.
So then after the 5 years is up, that's when you come out here.
That's when I came here. So that's when my whole this journey of testing my grit basically kind of finished. And that too just before, I'll just mention here, just a passing note, 2 months before my exam. So I was just about to finish my residency program, and there is exam, Royal College exam. Just 2 months before that, my father passed away without any notice. He talked to me about 8 hours back, and then I get a call later that he's no more there. Yeah, and I have to go back to India. I was there for 1 month. I had a huge amount of support from my residency program, and also I was working at Sick Kids Toronto at that time. Dr. Kelly was very supportive. I think all my staff was very supportive for me at that time. Yes, yeah, and yeah.
Okay.
Yeah.
So resilience once again, getting through it. So then you come out here. When you come to Vancouver, are you considered to be officially an orthopedic surgeon then?
Yeah. So I am, but there are no hip and knee arthroplasty surgical jobs here. Or if they are there, they have already pre-decided, and not that I'm complaining, and I do understand how the jobs are.
Well, tell me how, and I'm not, this isn't to be critical, and I don't want to put you on the spot, Doctor. I really don't.
Yeah.
Okay. I appreciate that. But how does that work? That there's no positions.
Yeah.
Explain that. So
first of all, I'll start from my side. I usually like to start from the other side because my side of the story is smaller, so I'm going to start with that.
Okay.
Obviously, I'm a hip and knee arthroplasty surgeon. I want a job. I want to work. I want to give happiness and pain-free, good quality of life to my patients, for which I have been trained for last multiple of years, right? And that is what I want to do, for sure, right? So, and I would certainly like to have a job here. And after putting in those number of years and effort and grit, I wanted to choose the place of my living. And that's why I somehow was so much attracted to BC because of the nature.
Not uncommon.
Yeah.
I'm a transplant too.
Yeah. And I thought that I have done a lot in my life, had gone through a lot in my life. Now, at least I deserve this much that I would like to make my own choices here. That's number one. So that's my side of story. But then most of the people, they just usually talk about only their side of the story. So we also need to understand this is a publicly funded healthcare system. And before anybody blames a particular hospital or particular group of orthopedic surgeons that they are not opening up for another orthopedic surgery position, I think we need to understand how that will be done, right? Okay. So I always give just very simple example. If BC government is giving $100 to one particular hospital for orthopedic surgery program for 1 year, and then 5 orthopedic surgeons are working there, they will be earning $20 a year, right? And they had been earning that much of a money for last maybe 10 years, let's say, right? Would they like to not get that much of a money every year? If it was you, you want to keep that money, right?
Yep.
So that has to be understandable. That is one. Second part of it. So if same thing, government is funding $100 for that particular hospital, and let's say it takes $1 for one knee replacement. So how many surgeries can be done in 1 year? 100, correct? So even if those 5 surgeons offer a position and take one more orthopedic surgeon into the group, will the number of surgeries will go up? No. So even so, again, the patients will not be benefited. So that's second part of it. Third part, we have an infrastructure. If the hospital's operating rooms are fully utilized and they have no room to add one more OR or to accommodate one more surgeon, they cannot physically do it, right? Because of the lack of resources. So it boils down to the funding part, basically. So until unless that funding will be increased, you cannot really criticize the particular hospital, particular orthopedic group, that they are not offering the another position, right? So that's the other side of the coin. Now I'm just trying to present because it's always easy to get lost with my side of the story, meaning which I have the right to get lost, so having undergone that much of hard work. But that's not me when I talk about the problems. I like to talk about the other person's story too. So until unless the funding will be increased, which is also critical. Think about, you are in the government and you have funding available, and you are supposed to allocate that funding into various different things, which will be helping people. It's your responsibility. It's not an easy task. It's very easy to criticize people. Always.
No, it is. It's hard. It's really easy to criticize people. It's difficult to come up with solutions.
Yeah, but having said that, I'm still looking for a job, and I still want to offer patients hip and knee arthroplasty surgeries. My patients are usually very happy when they meet me in the clinic. Here I do non-operative work. I do surgeries, hip and knee replacement surgeries in Yukon and in Ontario when I go and do locum there. But here also patients there whomsoever I operate, or patients here where I do non-operative ultrasound guided.
So that's what strikes me as odd is that you can go there and provide those surgeries.
Yeah.
But there's no place for you here to do them. Is that correct, what I'm saying?
Yes. Meaning, no, I can do here also, but then there is no position at this stage.
There's no position
here. So see, again, that has to be understood in the context that I go to.
I'm trying to wrap my head around it, doctor. I am.
Yeah.
I am. I'm
of course.
Because it so you can go up to, let's just say, to Prince George, or you could go up to the Yukon, somewhere in the Yukon, and do that surgery.
Yes. And yeah.
And you do.
I do. In Yukon, in Whitehorse. So the number of surgeons are less there, and they have more funding available. There are few of the operating rooms, they stay vacant during the days, because the orthopedic surgeons who are working there will also be overburdened because of the work. So they offer positions that we can go there for a week, cover their call, do some elective cases, and do all that stuff. I'm currently in talks with some community here in BC. I'm not gonna give details, obviously, because it's right now. I think we should even take that out. Yeah,
that's fine. It's fine.
So
So there's just the down and dirty of this is that there's not a position for you here in the Lower Mainland to perform your orthopedic surgery, the surgery that you specialize in, hip
and
knee.
So I would not say that there is no position for me. I would say that there is no hip and knee arthroplasty position right now advertised by any hospital for the time being.
Yet we do have a backlog of people that are waiting for that surgery.
Yeah.
I can personally attest to that because I have a friend that's
there is a huge amount of a backlog, and people come to me, and because talking about the problems in the healthcare system, right? So I try to give my patients lowest amount of the waiting time. So most of the people, they come talk to me about their problems, and I guide them with their short-term plan, not long-term plan, because orthopedic surgery, when there is a chronic issue, we can treat it with the short-term and not the long-term plans. And so many of them, they are at a severe, with the severe osteoarthritis of the hip or knee or shoulder, may need a shoulder or hip or knee replacement surgery. I do offer them ultrasound guided interventional kind of a pain medication, cortisone injections, but it's not a permanent solution. And if those injections are helpful, they are great. But when they become useless for those patients because of the advanced arthritis in their joints, at that stage, they would certainly want that they get relief from their pain with the help of a surgery, right? So, yeah.
So I'm going to ask you a question. If I needed knee replacement surgery, and you can tell me if you don't want to answer this question because it's kind of goofy. But because would I be better off to go up to somewhere in the Yukon and get that surgery done there? Does that happen?
So
if I'm on a waiting list here,
so
I'm thinking out of the box here and going, you know what would I do? Because I had both my knees done in a place called Rossland, which is just outside of Trail, BC. And they had an orthopedic surgeon that used to come in. I don't know if he came in from the States or where he came in, but it was like Tuesdays and Thursdays he'd come in and you could get the surgery done.
Where?
Yeah, it was in Rossland, BC, which is just outside of Trail because I lived in the interior of BC in Nelson.
Okay.
And there was a hospital in Rossland that specialized in orthopedic surgery on the knees. It was orthoscopic surgery, but he would come in and do, like, because I was skiing at that time and wrecking my knees and had torn cartilage and all kinds of things. But the question is that could a Lower Mainland resident go to the Yukon and
likely not.
Likely not.
The reason for that is they have a huge amount of wait time. Like it's about in the range of 1 to 2 years. One, they have only 2 operating rooms.
Okay.
So that is even in White Horse.
No.
So it is not sufficient for their own population. So they will not be able to cater to our population. So basically, again, that the constraint of the infrastructure.
Yeah. Okay, I understand. I understand. So currently, you're looking for a position, an orthopedic surgery position in the Lower Mainland here, but you're going up north or wherever you do to when you can to perform that surgery.
Yes.
Okay.
Yeah.
And
for the Yukon patient.
Okay.
Just to specify.
Okay, for the Yukon. Okay. Now let's talk about your current role. Your practice. We can talk about your philosophy of practicing medicine. And this is something that we got into. We were talking about when we first met. Your current role. What are you doing right now?
Yeah, so I'm working in BC. I'm working in Surrey in a clinic where I offer non-operative treatment. Whenever we see orthopedic surgery related problems and patients, I can tell if I see 100 patients in a clinic, there will be about 15 patients who may need surgery, and there will be 85% patients who can be treated with the non-operative treatment based upon exercises, physio, and then intraarticular cortisone injections or hyaluronic acid injections. And currently PRP is also becoming quite in vogue these days.
What is PRP? What is that? They take the blood or whatever?
Platelet-rich plasma. They take your own blood and spin it, and so it spins and into 2 components, and we take the platelet-rich plasma component out, which has growth factors, anti-inflammatory factors. We inject that into your whichever area of inflammation or joints or tendon, peritendon areas. That decreases the inflammation, has growth factors, improve the environment for the cartilage wear and tear. It does not rebuild the cartilage though, based upon all the randomized control trials. And So that's basically the role of PRP.
Is PRP currently being used? It's
Yes.
It is.
Yeah. It is being used.
Because I've heard the term thrown around here. So basically, you're taking your blood out, you're spinning it around, you're taking the good stuff out, and you're injecting it into the joint.
Yeah.
And it acts. And it works.
Meaning studies are still there, and
So it's still in its infancy.
I would say it works in earlier stages of the disease. One, it works better in younger population, and it also works better where you have the inflammation around the tendon insertions. Those are the areas, because those patients are usually younger also. So it works better in those circumstances. Also, where we do not want to use the cortisone injections very frequently. Again, those are the younger populations.
Yeah.
So cortisone injections we do mostly in elderly population, where eventually the next step of the management will be
A replacement
surgery. Yeah.
I understand. So you're back to your you work in Surrey.
Yeah.
You're obviously you speak English, you speak Hindi, Punjabi. So you've got 3 languages. You've got your talk a little bit about your philosophy from dealing with your patients. Talk a little bit about that.
Yeah, I think so. Surrey has a diverse population, like multicultural people from many backgrounds, and I have the ability to speak in English, Punjabi, Hindi very fluently, and then also I'm able to converse with people of Muslim origin, because their language is also very similar to Hindi or Punjabi. So I think that makes them very comfortable when patient is able to talk about their pain or their difficulties, their fears in their own language, and the physician is able to understand that always build the rapport and the trust between the doctor and the patient, and that helps to get better outcomes. Patients always feel that they are heard better. So that kind of really helps me to get into the give help to the people of the community.
So without putting you directly, I don't want to put you on the spot here, but I'm gonna.
I'm good.
What's the challenges, the biggest challenges of the Canadian healthcare system right now?
We all know that it's the wait time.
It is
always the wait time.
Always the waiting
It's the wait time. I feel so bad about our population and people when they have to wait when their pain is miserable. Meaning, I'm okay treating patients where the arthritis or that condition is in their early stages, and then I can guide them. You know what? I'm going to treat you, but then let's get in the referral for your potential surgery sooner, because maybe in 2 years you may need it, but right now we are not in that stage. So let's just start the process. But then when patients come with the collapsed hips, I've seen multiple patients with the severely arthritic joints. My heart goes out for them, and there is not much guidance even for them. Even it takes 6 months to 9 months to see an orthopedic surgeon. So at least I'm for sure filling the gap for that. I see those patients, guide them what is a short-term management and what is a long-term management, and those patients feel heard and understood, and they also now understand what are their expectations in this scenario and how can they manage their pain better. I have seen even patients, meaning obviously from Surrey, but then patients come to me from Langley, Maple Ridge, Abbotsford, Hope, Chilliwack, even sometimes from Kelowna too. And
really,
it's only, and why is that? Because the wait time is
so long.
Huge, right? It's so long, and when I see a particular problem, meaning, okay, think about that I do have a problem that I want to do surgeries and want to work in a hospital, but we'll see when that can happen, one. And then I have also done my exams for US. I think I can work for US also, depending upon where I can get a job, and I can keep on working on both the sides of the border. But when I see a problem which is in my hand to provide a solution, and I think wait for an orthopedic surgeon in Canada is so long, I try to provide a solution for the patients. So I usually see patients based upon the urgency also, because when I get referrals, I go through them and see patients accordingly, and keep the wait time as low as possible. Yes, but it's not 9 months for sure. It's like 1 or 2 months.
Yeah. So you touched a little bit. You talked about the Indian healthcare system and how it's more business, or the business, the financial part of it is more preeminent. And that's not to say that it's not honest and ethical. It's just more business. It just, because I ask the question all the time, why, if the problem that exists currently in our system is purely monetary, or is it that we're not, the system needs to change the way we approach it? Now, I'm asking you a question, and I don't want to get you into trouble with that answer. But having been through the healthcare system with a crisis of my own, and I have no problem sharing this with anybody that's listening, I did have a seizure. This is, I don't know, a couple of years ago, and went through the process. And I know for a fact that if I did not have my wife advocating for me, I may have died in the hospital. I mean that. And that's here. Yes, here. And my story is not uncommon. It's not uncommon. If you don't have somebody advocating, or you're not,
it's also our responsibility. I would say that meaning as a physician is supposed to be your health advocate, right? That's one of the pillars in the Canadian CanMed rules.
But when we don't have enough of them, it's very difficult for them. And the issue always is, and nobody wants to talk about it. We don't, in public, we don't, governments don't want to talk about it. And you keep on hearing stories, and this is one of them, where you have someone who has the credentials, who has jumped through all the hoops, and you should be practicing what your specialty is where you are. Now you go somewhere else to practice that. And at the same time, there's a waiting list for people to get hip and knee replacements. There's got to be a potential solution to it. And I don't expect that we're going to come up with that sitting here talking. But at the same time, we need to talk about it in order for us to solve it.
Yes, for sure.
Or to attempt to solve it.
Of course.
To me, it does not appear, and I'm adamant about this, that it doesn't appear that we are even attempting to solve it. It's just an expectation that you're just going to wait and wait and wait and wait and wait. And when you're, I'll just say 65 or 70 years old, and you have to wait 2 or 3 or 4 years to get a knee replacement or a hip replacement, you don't know how many years you have left. Really. True. And it's a quality of life issue.
It's a quality of life issue, right?
Right.
That's very important. I talk about it all the time to my patients.
So if you were to, put you on, like, if you were Minister of Health for a day.
Very nice. I like that.
If you were Minister of Health for a day, like, where would you start?
Start with creating more infrastructure and trying to get the funding for that. How? That I don't know, but then that's the step moving forward. We are living in a developed nation.
Yes.
Right?
Yes. Very developed.
Very developed. I'm not living in some developing nation here, right? And when I used to hear, again, it's not related with my branch. So, but again, there was no cath lab in Surrey. I think it has recently
They've got one now.
They got one now. It's a huge amount of a population. If you live in India, you will be able to get a cath lab like so quickly, like in whatever 10 or 20 kilometers, right? But not here. How is that possible? So when talking about the government and the policies, sometimes I do feel that our nation collectively, Canadian nation I'm talking about now, is not very forward looking. There is a lot of delays in the decision making, and we are lagging behind a big time. We really need to learn a lot and move with the speed now, otherwise we'll lag behind, especially with our neighboring country, because we both used to be like, obviously we are developed nations, but we used to be at par. I think they are moving forward still at a better pace as compared to us, and that concerns me as a citizen of the country.
Do you attribute, and this is an opinion.
This is a big topic.
It is. It's a huge topic. It is. But do you attribute that to, okay, we have a publicly funded healthcare system. They have a privately funded healthcare system. And I'm someone that's spent a lot of time in the United States. Okay. And I used to hold up Canada. I used to, and say that, and they would call that socialism and all kinds of words, isms. And I would argue with them and say, listen, you know what? If you need healthcare, it's there for you. But it has, I'm going to say in the last 10 to 15 to 20 years, it's deteriorated.
It has. Yeah.
It has. It hasn't gotten better.
Yeah. And
by better, I mean, like you're talking about a specific piece of equipment that's needed. Like even I know this because I've served on foundation boards of hospitals. They don't gang purchase equipment. For instance, that machine that you're talking about, the Fraser Health Authority has, I don't know how many hospitals under it, but why can't they go and say to the manufacturer, we need 9 of these?
Yeah.
And each foundation, they're responsible for raising money to buy that equipment, which is, like, most people don't know that. They don't understand that.
And then you decrease the price too.
That's right.
That. Bulk buying.
Yeah.
But what I was talking about when I was talking about infrastructure, we need to build the infrastructure, meaning hospitals. We need to have more hospitals because the already existing infrastructure is fully utilized, it seems like, and then we need to create more based upon the population which is increasing.
Yes.
So we need to do more on that, because once you build a hospital, you obviously going to need equipment, surgeons. You're going to add those. You have no choice but to add those. But that will happen only once that infrastructure is built. When I talk about lagging behind in moving forward for my nation, look at China, and even for that matter, US also. They are far beyond us, right? And it seems like we'll lose the race. It looks like as if now, until unless we correct our course as a nation, as a political system, because you said being a healthcare for a day, a healthcare minister for a day, right?
Yeah.
So I'm just not talking only for the healthcare here. I'm talking about overall country. When I came to, just a short passing by note, when I came to Canada in Calgary, and I saw there is not much of a communication between provinces, and there is not much of a business between them. And I was furious. Just talking with my friends, I was like, what kind of a nation is this that they do not, utilize their resources for themselves? Meaning, I have an example. I don't want to say that. I don't want to get into trouble. But they do not communicate and don't do business with each other so that they all can be prosperous.
They can't share. What you're saying basically is you can't share best practices. You can't, well, this worked for us or whatever. They don't even do that.
And I said that when I came here in 2015, maybe I might have said it in 2016, because I observed it for a year or so, and now they're talking about they can raise the I don't know the by 7% the whole financial income of the country by 7 billion or something like that. I don't know the number now, just by increasing the business between the provinces. Yeah, now they are talking about that. So why it took so long to talk about it, to start, meaning they have just started talking about it. I don't know when they're going to implement it. So
the other thing too is that they just announced at SFU that they're building a medical school.
Yeah.
Okay.
I know that.
And I actually reached out to the guy who's in charge of it. He'll come on. He's going to come on. And he said, give me 6 months.
Yeah.
Because I just got here.
Yeah.
Yeah. But that's the first medical school that's been built in, I don't know how many years in this country.
Can you imagine?
Exactly.
Oh my God. Yeah.
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 So we have our own residents that are going to other countries to get educated.
Yes.
And then sometimes we lose them because they don't want to come back.
Of course, yeah. You lose a lot of them to Australia right now. Yeah. I think you're losing to US and to Australia. Meaning, I have my exams done for US too. Not that I'm saying I'm leaving, but then
you could.
Yeah.
You could. You could very well.
Yeah. Who's gonna wait for long, right?
Yeah. So now I still want to stick on this Minister of Health for a day thing. And I know but okay, you're talking about communication between the provinces. What about communication between the hospitals too? Does that it seems, and I'll tell you this, with the issue that I'm tenacious. Like I'm just, if you don't know that about, I'm tenacious. I won't let anything go, and I will advocate for myself and till the point where I become a pain in the ass, and you either have to deal with me or, I'm not going to go away. And when that specific instance that I was talking about with my seizure, I had to get an EEG done on my head. Okay. Now I did the research and you know how hard it was to get booked in to get an EEG done when you have a seizure and then you get your driver's license taken away from you, and you can't get your driver's license until you get that and you go see a neurosurgeon, or it was a neurologist. Neurologist.
It takes how much time?
Oh, it took me 6 months.
Oh.
Yeah.
Wow.
Which and the thing is, and that was being like, I was like, and that's ridiculous.
It takes away your independence.
Exactly.
Yeah.
And that just drove me crazy.
Yeah.
And there's got to be a better way to do it.
Yeah.
But we don't, it's like the elephant in the room that we don't talk about. Nobody talks about that.
Yeah.
So you just Minister for Health for a day, you're talking about more communication starting between the provinces.
Yeah.
But
infrastructure.
Yeah, and infrastructure for hospitals. And obviously when there's communication, that creates, I don't like whenever someone says more efficiency, they think that means less people. There's a way to become more efficient that doesn't necessarily involve less people. Like that's always the bugaboo that they talk about in Canadian healthcare.
Efficiency for a surgical practice is that we do more number of patients in a day with efficiency from as a surgeon, meaning if I have the ability to finish a surgery in 35 minutes
than
1.5.
What I'm talking about specifically is creating more healthcare dollars for that surgery by becoming more efficient, by allocating funds properly
towards
as opposed to administrative bloat. Let's just use that as an example.
I agree.
That's all I'm saying is that do you need 50 vice presidents of whatever you want to call it for this health region? And I'm not specifically saying any health region. I'm just talking about administrative bloat.
Yeah, I think I'm not expert on that topic.
Yeah,
but meaning it's certainly that issue comes up so frequently, and there should be some truth to that. That's what I can say, though.
Yeah.
Meaning I don't have much of a knowledge on administration side, but I think there is a lot of redundancy there. Meaning if Trump will be he's gonna own this, or he'll the health minister, you will see the effect.
Yeah.
Meaning, although not that I'm saying I'm a Trump fan or not a Trump fan, don't take me in any which way. I'm just talking about creating efficiency for patients and removing the redundancy from the administrative side. That's what I'm talking.
So in just wrapping things up here, what advice would you give to other, if there were any other international doctors that are currently looking at coming to Canada, what advice would you give to them?
It's gonna
be resilient,
very resilient, and it's gonna test your resilience in every possible way, every day for a number of years. It's not gonna be short. So make your decision very wisely. And sometimes people think that, you know what, you have become orthopedic surgeon in Canada, so you are kind of don't want others to be. It doesn't come from that space. As I said, that I went through that. Those 3 years were totally dark, and I personally don't want somebody else to go through the darkness. They should have better light or a better system available. How can I outline it for them? If you want to come, so first thing is resilience and grit. That's one, obviously. Second, you have to be the permanent resident of Canada. You cannot come here as a student or visitor and then you can think, or even on a work permit, you cannot apply for residency program. So those are the administrative sides, and then you have to qualify, do the qualifying exams. It is still relatively easier to get into a family medicine residency in comparison to orthopedic surgery residency. There are only 4 positions in orthopedics. So it's not at all easy. It's an uphill task, and you don't know whether it's going to happen or not. And when I say that I got one position, I never take any credit for that. I always say that the residency program, they chose me. They saw something in me. I really don't know what, because there were many students who applied and who were good also, right? You have to understand that part. And then I also say that thanks to God for putting me in that position, right? I was the one who was chosen.
Yeah.
So, meaning because there are many people who have the similar kind of credentials. So surgeons, it's a very difficult task. If somebody is a physician and they want to look into family medicine, that's relatively easy. And there are programs in Manitoba and Saskatchewan, which offer you training for about 2 years, and then you get into the healthcare system.
Okay.
But then this is also important, just having said that, people should not, meaning the physicians who are coming from different countries should spend time working here, because healthcare system is, meaning you being a physician does not mean that you are just a medical expert here in Canada. You need to understand the social structure of the healthcare system too, right? How the healthcare system works, what are your duties, health advocate and all other stuff. It's a publicly healthcare system. You might be coming from India, where most of the healthcare system is more like private, like US.
Yeah.
So you have to understand the social structure of the system, and it takes time. I've seen few of the physicians coming from different countries behaving totally very entitled, and with sometimes with the patients, but I've seen them while working with the clinic staff, very entitled, and nobody here in Canada works with that kind of behavior. So and it comes when you go through the credentialing process, when you have to learn up every day, and you see your preceptors, the way they behave with others, and then you introspect and modify your ways of behavior too, right? Because everybody deserves the respect.
So if you were, if somebody watching this, and I encourage everyone to subscribe that does watch this to Ship of Fools, where wit meets wisdom. If they wanted to reach out, to you, are they able to reach out to you directly?
No.
You have to go. It was a referral.
Yes.
Everything has to be referred.
Yeah. So your family doctor would have information about me, and they can send me the referral. Although I have to say that here. So whenever, if I'm working in Canada, I'm not supposed to advertise about myself. I cannot, I should not be the one who should be saying, oh, you know what, you want to come to me? Here is my this, and then, you get a referral. So mostly it goes through your family doctors.
But
and
it's Dr. Raghav Saini. I'll say it.
Yeah, you can say it. Not
It's not an any.
and it is not. And then also I cater to a huge amount of a population, and I'm pretty busy for that matter, and sometimes I scratch my head to take time off, right?
I understand.
But and I do take time off in many ways. I do what I want to do. I do hip and knee replacement surgeries where I want to do, even though I'm not got an opportunity. But I am not one complaining. Second, I'm very relentless, as we were talking. I'm doing that. I'm also living where I want to live.
Yes.
So I'm doing whatever possible for my own soul, what I want to do, and to make myself happy too. Because if I'll be happy, I can make others happy too. That's what I feel like.
Well, Dr. Raghav Saini, thank you so much for coming. I appreciate you. That was great. That was wonderful. You enlightened us, and you made us a little bit more understanding of orthopedic surgery, what an orthopedic surgeon is, and the process of coming to Canada as a doctor. And for that, I thank you. Thank you so much.
Thank you very much.
Thank you. You may be asking yourself, what's any of this got to do with me? Absolutely nothing. Until next time.